And Kathryn Jacobsen is here to provide more insight. She specializes in global health epidemiology and is a professor at George Mason University. Kathryn, thanks for joining us. Nigeria is now preparing to fight coronavirus on its soil. Health authorities there say fighting Ebola has given them a head start. How so?
Absolutely. Nigeria was one of the countries that had a patient with Ebola travel to it during the West Africa Ebola outbreak in 2014. And while several healthcare workers were infected, Nigeria had a public health system that was set up to identify those cases, to isolate them, to quarantine contacts, and they were able to keep this from becoming something that spread locally. So they've got that history of being able to do this kind of case containment that everyone is calling for with COVID-19.
Are you surprised that until now we've seen very little COVID-19 activity in Africa or even South America? Could temperature be a factor here?
We don't yet know if there are environmental factors that are changing the pattern in different parts of the world. We also, with the case of Africa, don't know to what extent there may be cases and there just is not the laboratory capacity to detect it yet. As we've seen in other countries, this is not an easy test to run. So a lot of countries, including the US, don't have scaled up testing capabilities yet. In African countries in particular, it could be very difficult to test for this, even with a case that looked very suspiciously like coronavirus.
We heard from a journalist based in Tehran that the health minister there had been telling authorities for weeks that something is going on, and it seemed very similar to suggestions in China that this actually started a few months ago. Do you think you'd expect to see much higher numbers in Iran based on the fact that this could have been much more present than we know?
It is a very uncertain epidemiological situation still in a lot of countries. We're still not quite understanding what percentage of people show symptoms. And so clearly in the Hubei area, we saw a high number of people who had very serious infections, and we were seeing a lot of deaths. In the rest of the world, it seems to be unfolding maybe a little bit more slowly. We're discovering places where there is local transmission, where we aren't seeing a lot of deaths yet. That could just be a timeline issue, where we haven't yet scaled up the number of people who are infected enough to see a lot of deaths. It could be that this is behaving differently, and we're just not quite sure how that's going to play out in different countries with different geographies.
Here in the U.S., we've had one confirmed fatality, a man in his 50s in the western state of Washington. For Americans, is this a game changer?
Possibly. We knew that local transmission would start happening in other countries outside of China because we've seen it in places like South Korea and Japan and Iran. So the U.S. has a large population. It's not surprising that we'd start seeing some of that. Right now, the question is how many people could be infected and just not know it yet? And that's the same question we would ask in African countries of, is there local transmission happening that we haven't detected, or is this really not something that's widespread at this time?
Donald Trump says that on Monday, American vaccine makers will meet at the White House. Is this where hope lies right now, in a vaccine rather soon?
The vaccine, because we have to test for efficacy and safety, and then we have to manufacture it, that takes a long time. So we need to be thinking ahead. It's good that vaccine manufacturers and governments around the world are partnering to try to accelerate development, but this is not something that we can do in the next couple of months. We still have to be doing the isolation, contact tracing, and quarantine that are the public health measures that China implemented.
Is there any indication what % of people who are testing positive remain asymptomatic?
It appears to be fairly sizable. Now, that depends on how many tests we're doing. If we only test people who are already sick, of course, they're going to be symptomatic. The countries that are testing more widely are finding quite a few people who have very mild symptoms or no symptoms. That's concerning from a transmission standpoint. If they're contagious and they're spreading this in the community and we don't know that they're doing that, we can't really contain it. So that's one of those mystery questions that several months now into the outbreak, we still don't have the data to say conclusively what's going on.
I've asked you this every time you're here. I'll ask you again now. Have you changed any of your own behaviors?
Because it's flu season, am washing my hands more often. I am not shaking hands with people as often as I typically would do. We don't have local transmission here in the DC area where we are. And so the idea of taking extreme precautions at this time is not called for, but we all have to be ready to do things like not come into work if we're sick.
I always tell people to listen to the doctors, so I have to ask the doctors. Thank you very much, Kathryn Jacobsen.
Glad to be here.